So welcome to the Mycology MCQs session. Let's go through the questions. Number 1, Candida albicans. So let's go through the choices as we eliminate. Choice A is a common causative agent of pyelonephritis. Is that true? What is the most common cause of pyelonephritis? Pyelonephritis means, so I told you anytime you hear the word itis, that is inflammation. Then nephro, that is something to do with the kidney. Then pyelonephritis, this means that there is inflammation of the kidney. So there is acute pyelonephritis and chronic pyelonephritis. But in general, what is the most common causative agent of pyelonephritis? Were you able to go through the questions?
Yes.
What is the most common cause of pyelonephritis? The most common.
Personally, I didn't come across any fungi which is a cause of pyelonephritis.
Yeah, so the most common cause is bacteria.
Yeah.
Which bacteria?
Is it Proteus?
No.
Klebsiella?
Yeah?
Klebsiella?
Not Klebsiella. It's actually E. coli, okay? E. coli is the most common cause of pyelonephritis because it starts as a UTI as it ascends towards the kidney, okay? So for Candida, you know, Candida is a fungus and it is mostly seen in immunocompromised individuals or people with indwelling catheters, okay? Then choice B is not easily detected in microscopy of centrifuged urine deposit. So that's a lie because it can be detected. Okay, remember Candida, the yeast can be detected when you centrifuge the urine, then you look under microscopy. So remember the pattern. What is the pattern of Candida? There's a specific pattern of Candida. What are you looking for when you see in microscopy?
Germ tubes.
Okay, yes, germ tubes. But before we look at the germ tubes, like in general,
Pseudohyphae.
Pseudohyphae, yes, very good. So it is very characteristic of Candida where we see the pseudohyphae and the yeast. Okay. Then grows in blood, agar medium. Yes. Which other medium does Candida grow in?
SDA.
SDA, yes, in full. Suborodextrose agar, okay. So on blood agar, it will appear like creamy white colonies. Okay, so that is the answer for number 1. Oh, I'm shocked no one got number 1 correct. Gram-negative spherical cells larger than bacteria. First of all, if you were to gram stain Candida, what will we see?
Gram positive.
Gram positive, yes. So that's wrong. It's generally gram positive. And spherical, yes, that's true. Usually oval. Okay. And you're going to see the yeast cells. They are oval in shape, but they're not gram negative. Then E, recognized by microscopy as yeast with polysaccharide capsule. What bacteria is what fungi is that?
Cryptococcus.
Cryptococcus, neoformans. Good. So I hope that's clear. Number one. Then number two, a 30-year-old man is admitted to the intensive care unit after his wife found him unconscious at home. Lab studies shows a serum pH of 7.1 and positive serum ketones. His mucous membranes are extremely dry. However, he now has a fever, headache, and eye pain. Examination of the nasal cavity shows black necrotic eschar adherent to the inferior turbinate. Which procedure was most likely reveal the pathogen responsible for the patient's infection? So the black necrotic eschar is very specific. That's one fungus. Which fungus is that? Did you guys go through this when I sent you the answers?
Yeah, we did, but
Or you didn't
I
find that
didn't.
in the notes?
I didn't. Yes, I was not able to come across it.
Did
Of course,
you?
I had A. I had A as an answer, but
Okay.
I'm not too sure.
Did you see rhizopas, muco and rhizopas species as a bacteria? Sorry, as a fungus. Have you heard of that? The disease is called mucormycosis. It's in your notes. I want you to go check. Okay. So what happens so that next time if you see a question like this is you have to know that on presentation, the patient is going to have a necrotic eschar on the face. Okay. It looks like it's black in appearance. Okay. And that is mucormycosis caused by rhizopas species, muco and rhizopas species. Okay. Now, what you usually do is we do a biopsy. So the answer is C. We do a mucosal biopsy. When we biopsy, we're going to see the fungus. It is characterized by irregular, broad, non-septate hyphae branching at wide angles. So I don't know if there is a picture. I don't know if I have a picture, but if I have it, I would have shown you. Okay, so I want you to check on that. Mucormycosis. Okay. I hope you've written that down. Mucormycosis. And the fungi responsible is rhizopas species. Okay. Then number 3, which of the following pathogenic processes is most important during the development of pneumonia due to histoplasmosis? So you guys there are certain fungus that cause pneumonia. We have histoplasmosis, blastomycosis, coccidiomycosis, paracoccidiomycosis. Okay, I know the names are large, but it's good you classify them like that. Okay. So for histoplasmosis, what's the answer here? Number 3.
A.
The answer is? The answer is A, yes. Intracellular proliferation within macrophages. So first of all, you have to know histoplasmosis. It's caused by Histoplasma capsulatum. Okay. And so this Histoplasma capsulatum, how do you get it? Number 1, you have to inhale the spores. So one thing about fungal pneumonia is it is not spread from one person to another. You see how these other types of bacterial pneumonia caused by strep pneumoniae, when you're in close contact with someone, they can infect you. But for fungal pneumonia, it only affects those who are immunocompromised and is spread by inhalation of the spores found in contaminated soil. So specific to histoplasma, it's usually found in contaminated soil by bat droppings or bird droppings. Okay, so it's common in things like caves. Okay, then it has a same pathophysiology just like TB. They hide themselves within the macrophages because what is going to happen is phagocytosis will take place by the alveolar macrophages. And then while they're there, they're going to transform into the yeast. Okay, so inside the macrophages, the histoplasma is going to survive and proliferate. Okay, so that is the pathophysiology of how histoplasmosis is. Invasion of vascular endothelial lining. What fungus is that? Have you heard of Aspergillus?
Yes.
Yes, so Aspergillus is the one that is, we call it angioinvasive. It invades the vascular endothelial lining. Overgrowth and tissue invasion by endogenous flora. Yeah, there's none like that. Production of an antiphagocytic polysaccharide capsule. This one we have done. Which fungus does that? Navia, you've just told us. Which one has the polysaccharide capsule?
Cryptococcus.
Cryptococcus, yes. Transformation into a mycelial form in tissue. So to understand what that means is, you see, there are some terms we use for fungi. We have dimorphic, okay? We have single-celled. So anytime you hear a fungi that is single-celled, that is a yeast, okay? Then, if it is multicellular, it has many cells. It is, the words that you can use is filamentous. So you'll hear the word being used, filamentous. It can be a mold. These are multicellular fungi. Then if you hear the word dimorphic, dimorphic means it can either be a yeast or filamentous, meaning it can either be single-celled or multicellular. Okay. Now, most of the time, they usually say at 20 degrees Celsius or at cold, okay, when it is cold, it is usually multicellular. It becomes multicellular, a mold. Then when you increase the temperatures to like 37 degrees Celsius, in our bodies now, it becomes a yeast. Okay, that is the pattern for dimorphic fungi. Now, transformation into a mycelial form in tissues. So we said in tissues, it's at 37 degrees Celsius. So you expect it to transform into a yeast rather than the mycelial form. So the mycelial form is at the environmental temperature. So things like 20 degrees Celsius or room temperature. Understood?
I have a question.
Mm-hmm.
So you said that, so which bacteria are we talking about in E? I mean, fungi?
Fungi. No. This statement is false. Like I was explaining in terms of general fungi. It can
Okay.
exist in two forms. The first form is the single-celled, which is it is yeast. Okay. Then it can also be multicellular. Multicellular are things like mold. We call them filamentous mold. Okay. Now, if we say a fungus is dimorphic, this means it exists in both forms. Okay. At room temperature or outside the body, it exists as a multicellular organism. Okay, a filamentous mold. So how I remember, I usually say cold. At the cold temperature, it exists as mold. Okay, then within our bodies, at high temperatures at 37 degrees Celsius, it becomes a yeast. Okay. So the fungi I'm talking about are the ones that cause pneumonia, the histoplasmosis, blastomycosis, coccidiomycosis, paracoccidiomycosis. Those are the ones that are the dimorphic fungi. Okay. Also, Candida is dimorphic. Okay. So this statement, transformation into a mycelial form in tissues, that is false. A mycelial form is not within tissues. It is within the environment. So if the answer would have been transformation into the yeast form in tissues, that would be true. Okay, that is how we are eliminating choice E. Because histoplasma exists in yeast form as a yeast in tissues. Okay, understood?
Yeah.
Okay.
And for C, yeah. Shouldn't Candida albicans be the one causing C?
Overgrowth and tissue invasion by endogenous flora. Yeah. Candida is the one that causes overgrowth. Yeah, true. Yeah, thank you for that. Then number 4, which of the following is the most appropriate pharmacotherapy for a patient with Cryptococcus meningitis? So there are specific drugs, the pharmacology aspect of the fungi, and you have to know, especially Cryptococcus, tinea, and which other one? Yeah, and Candida. Those 3, they're the most important. I think it's within the questions. We're going to go through them. But for Cryptococcus, which drugs do we use?
Amphotericin B.
And flucytosine. Good. So it's usually procedure, like there's a protocol on how we treat patients with Cryptococcus meningitis. But what I want you to know is, remember, you cannot just get cryptococcal meningitis. It is only seen in immunocompromised individuals. And the immunocompromised individuals are mostly patients with HIV and AIDS because their immune system is very weak. So we do it in different phases. I don't want to go into details, but what happens is we have an induction therapy where we give amphotericin B and flucytosine. So flucytosine is never used as a monotherapy. Basically, if you see a choice where it's saying flucytosine alone, that is wrong. It can never be used. It's used together with amphotericin B. Okay. Now, okay. And then you give that for a while, and then after that, you now give fluconazole as we call it maintenance phase. You usually give it for like a whole year to clear out the Cryptococcus meningitis. So the answer here is amphotericin B and flucytosine. What about choice B? Isoniazid, rifampin, pyrazinamide, and ethambutol. Which organism is treated by those drugs?
That's for TB.
For TB, good. Cefotaxime and ampicillin, these are antibiotics, so these are used for bacteria. Pyrimethamine, sulfadiazine, for this. No, this is not. This is this is for a protozoa. So you have not done protozoa, so this is just an incorrect statement. The protozoa in this case it's called toxoplasmosis. Okay. Number 5. A 61-year-old man is brought to the emergency department by his wife because of increasing confusion over the past 12 hours. His wife reports that he has a history of type 1 diabetes mellitus. Examination shows left periorbital swelling that is tender to palpation, mucopurulent rhinorrhea, and black necrotic spot over the nose. So what fungus is this? This is similar to this, and I had mentioned. Number 2 and number 5, it's testing the same fungus. So what's the answer?
Rhizospos, yeah.
Rhizopus microsporus. Okay. Candida albicans. What do you expect in Candida albicans for a question that is going to ask Candida albicans? What does Candida albicans cause?
Oral thrush.
Oral thrush. So you'll expect maybe they tell you oral thrush. Another one.
It can also invade the esophagus.
Yes, leading to esophagitis. So you'll have like difficulty swallowing or painful swallowing. Another one. There is one, especially in women. What does it cause?
Vulvovaginitis.
Yes, vulvovaginitis. Good. So it may present with discharge, okay, itching, okay. Another one, in children, there's a specific rash it causes. Have you heard of diaper rash?
Yeah.
Yes, it causes the diaper rash. Basically, when you're changing the diaper, you see a certain type of rash. So that can be due to Candida albicans. Okay. Then one thing to mention for the vulvovaginitis, as Bernadette has mentioned, the discharge is usually whitish. Okay, it's usually thick, and there is a specific name they may use: cottage cheese appearance. Okay. Then definitely when you look in microscopy, when you look into it, you're going to see the pseudohyphae of Candida. Okay, so if you see cottage cheese appearance on vaginal discharge, know that is Candida. Don't confuse with the one for bacterial vaginosis. Okay, it has a white discharge and a fishy odor. That was for bacterial. That is bacterial in nature. So as I was saying, don't confuse that with the bacterial vaginosis. Okay. Fishy odor, that is bacterial in nature. Cottage cheese appearance, that is Candida. Okay. The most common fungal causative agent of meningitis in immunocompromised patients. So this was very direct. What's the answer? What's the answer here?
A.
Cryptococcus neoformans. Yeah, this is very direct. So maybe I'd love us to discuss, because I feel like, because they can ask the question in very different ways. They may ask that, and then they ask you, what do you expect, or what is the appearance? So in Cryptococcus neoformans, what do you expect to see? So we mentioned the polysaccharide capsule. What else? So you guys tell me things about Cryptococcus that you know.
It can cross the blood-brain barrier, and it can also make melanin.
Yes. Another one. What will you see on CSF analysis? CSF analysis of Cryptococcus meningitis. Okay, let me be now specific. When you're using India ink stain,
You'll see the capsule.
the capsule, yes, we call it the halo appearance. Okay, a clear halo appearance. Okay, and then when you're doing with the, what is it called? Suborad, dextrose agar, what will you see? Mhm. So, okay, let me help you. You're going to see narrow budding, okay? Then you're going to see the encapsulated yeast because it is in yeast form, okay? And then what will you see when you stain with the mucicamine? What will be the color of the polysaccharide capsule? Am
Sorry,
I
could you repeat when you stain with?
mucicamine. Let me write it down. Mucicamine. Am I talking Greek? Have you heard of these things?
Yeah.
Mucicamine stain. Hmm?
Yes.
What color will the polysaccharide capsule be?
I'm not so sure. Is it white?
No, it's red. So for white is for the Indian ink. Then red for the mucicamine, okay?
Okay.
Yeah. Okay, and remember, Cryptococcus only exists in its yeast form. There are no hyphae. Okay. So these words, take note of them because they are going to use it. So if you see anywhere hyphae, pseudohyphae is Candida. Hyphae, that is not Cryptococcus. Cryptococcus, the buzzing word will be the polysaccharide capsule, Indian ink. They may use the word mucicamine stain, okay? Pigeon droppings, you guys didn't mention, but that also, it's also a high thing. Okay. Number 7. Which of the following is not a virulence factor of Candida albicans? You guys tell me.
How about C?
IgA1 protease. Okay. That's correct. Now, let's go through the virulence factors. Biofilm. What is the function of a biofilm? Or where are they found? So biofilms are found in devices. So things like catheters, prosthetic valves, or any other medical device. Okay. Secretion of hydrolytic enzymes, that is true. These hydrolytic enzymes are things like proteases, phospholipases, lipases by itself, okay? So they break down and degrade the host tissue. Then hyphae formation. So that is true. We said Candida is dimorphic, exists in both forms, the yeast and the filamentous form. Now, Candida, as it transitions from yeast to the hyphae form, it's going to, this hyphae is used to penetrate the host tissues, okay? And it also resists phagocytosis. Then adhesins from the word adhesins, to the adhere to something. It is used to attach to the host cells. So when it attach, it can facilitate colonization. Okay, it colonizes the cells, leading to an infection. IgA1 protease. Where did we hear about IgA? I think I explained this when we were talking about bacteria. Which bacteria?
Streptococcus pneumoniae.
Streptococcus pneumoniae. Another one?
Neisseria.
Neisseria. Which one?
Gonorrhea.
Both gonorrhea and meningitis. And then the last one? Haemophilus influenza. Okay, so please don't forget. Now, this question. So there are quite a few questions of this type. A 45-year-old with cryptococcal meningitis is started on amphotericin B and flucytosine. After a few days, It develops hypokalemia, hypomagnesemia, and renal tubular dysfunction, which is the most likely mechanism behind its renal toxicity. Okay, so now let me show you guys. Okay, so this is a very high-yield thing in terms of antifungal therapy. These are all the antifungal agents that are used in treating fungi. So this is a fungal cell wall. Let's start from the outside going in. We start with the cell wall. So look at this cell wall. So remember, in bacteria, what antibiotics do we use for cell wall? What are the cell wall inhibitors? Give me examples. What is the most common?
Cephalosporins.
Okay, that's not the most common, but
Penicillin.
yes, penicillin,
Penicillin.
yes. So I want you to think of echinocandins as the penicillins of fungi. Okay, so they're called echinocandins. Here they are. So they end in the word fungin. Fungin. Okay, so the most common is usually caspofungin or caspofungin. I don't know, some people pronounce it like that. We have micafungin and indalufungin. Okay, then we go to the cell membrane. So this is the cell wall. Now we go to the cell membrane. For the cell membrane, we have amphotericin B. Okay, so amphotericin B. Okay, remember, you see in this fungi, they don't have cholesterol like in our cells. They have a special type of cholesterol. We call it ergosterol. Are you seeing here? Ergosterol. Now, this ergosterol is the one that is lining the cell membrane. Now, the function of they're called polyenes. Polyenes are things like amphotericin B and nystatin. How these things work is they're going to bind to this ergosterol. And when they bind there, they're going to disrupt this membrane integrity. Once the membrane integrity is disrupted, it's going to lead to the formation of pores. Are you seeing this? This is a pore that is going to be formed. Now, this pore is going to facilitate leakage of intracellular components. So things like the fluid, there's fluid inside the cell, and all those, they're going to leak outside. Once they leak, there's going to be, the fungi is going to die. Okay, so formation of these pores that are going to cause leakage of intracellular components. That is how the cell membrane inhibitors work. Now let's go inside. So we have this process leading to the formation of ergosterol. Squalene is converted to squalene epoxide by squalene epoxidase. The antifungal used here is terbinafine. It inhibits lanosterol synthesis by inhibiting this process, squalene to squalene epoxide. So it inhibits squalene epoxidase enzyme. Then squalene epoxide will be converted to lanosterol. Then lanosterol leading to the formation of ergosterol by the enzyme 14-alpha demethylase. So here are the azoles. They are called ergosterol synthesis inhibitors because it's the last step of formation of ergosterol. So here we have azoles, clotrimazole, fluconazole, isavuconazole, itraconazole, ketoconazole, miconazole, voriconazole. Okay. Then we go to the microtubules. So inside here, there are microtubules. They are inhibited. It inhibits the drug griseofulvin inhibits microtubule formation. Okay. And then inside the nuclei, there's nucleic acid synthesis inhibited by leucytosine. Okay. Are we clear? So I want you to remember this. It's going to help you both in mycology and in pharmacology because you won't struggle. Because they can tell you, describe the antifungal agents, their mechanism of action, and 2 examples of drugs. And trust me, if you have no clue, you will not write anything. And it may be as much as even 10 marks, okay? So we start from the outside, echinocandins, which are the fungins, cell membrane integrity, which are amphotericin B and nystatin. Then we go to inside, formation of the ergosterol. We have lanosterol synthesis inhibitors or squalene epoxide inhibitors, that is terbinafine, ergosterol, which is lanosterol to ergosterol. And then we have inhibiting microtubules, which is griseofulvin. And then we have inside the nucleus, nucleic acid synthesis inhibitors, which is flucytosine. Then terbinafine and griseofulvin are mostly used for tinea. So tinea, these are the tinea corporis, tinea unguium, tinea unginatum, tinea babae, okay? Those are the most common. Amphotericin B is a very toxic drug. It is only used for disseminated fungal infections, basically toxic levels of fungi, fungemia, okay? Nystatin is also very toxic. It is only used on topical. It is only used topically. If you use it IV, like if you give someone via the vein, it is very toxic for the body, okay? Are we clear? The most common used drugs are the azoles, okay? So I hope this process is clear because there are so many questions regarding this, basically asking mechanism of action of this, and this. So I want you guys to remember this. Are we clear? Any question? We are okay?
Yes.
Yeah, I hope that's clear. They won't get into detail where they ask you like the specific, you see for flucytosine, they won't tell you, oh, what is happening here. But basically, if you know it's a nucleic acid synthesis inhibitor, basically conversion of, interfering with basically RNA and DNA synthesis of the fungi. Okay? That's all you have to know. And then for echinocandins, they also mention they can give you a specific enzyme. We call it beta-1,3 glucan synthase. Okay? That one is used in the integrity of the cell wall. Okay? That is for the echinocandins. Yeah, and that's all. Now let's go to the question. Which number was it? Yeah. So we have been asked mechanism of amphotericin B. So what's the answer? What's the answer from my explanation?
C.
B. 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 B or C?
C.
You've said? C. C. Okay. Inhibition of squalene epoxidase. So chap, which drug is this?
Terbinafine.
Terbinafine. Good. Disruption of fungal cell wall synthesis.
Echinocandins.
Echinocandins like fungins. Okay, good. Inhibition of lanosterol demethylase.
The azoles.
Azoles. Good. Inhibition of beta-glucan synthesis.
Beta-1,3 glucan synthase.
So which drugs? Echinocandins. Okay. Okay, this is the one for the cell wall. Hi. Which of the following best describes the primary virulence factor of Cryptococcus neoformans? So this one we have done it. This is direct polysaccharide capsule. Okay. Hi, choice A. Production of aflatoxin. What drug is that? Sorry, not drug. What fungi is that?
Is it Aspergillus?
Aspergillus, yes. I don't know if you guys had heard of aflatoxin before even learning this. It's quite common, especially in poorly stored maize. It can form the Aspergillus fungi can cause formation of aflatoxin. Urease production, so this is more of bacteria. Thermal dimorphism. This one I has explained. These are the histoplasma, blastomycosis, the ones that they change. They are dimorphic fungi that change from filamentous mold in room temperature, and then they change into yeast in high temperatures, like in tissues. Then secretion of elastase. No, this is for bacteria. Things like Pseudomonas. Let's go to number 10. Each of the following statements concerning Candida albicans is correct except, okay, demonstrates dimorphism. I mean, we have said this. It demonstrates dimorphism, so it has the yeast form, which is the unicellular form, and the filamentous mold, or the hyphal form, which is multicellular. Transmitted primarily by respiratory aerosol, is that true?
It is false.
False. Remember, I told you these fungi, they're not like bacteria. These ones only come when you're immunocompromised. So how is Candida spread? I mean, it's not even spread, but you only get it when you're immunocompromised, okay? It's not spread. Budding yeasts that form hyphae when it invades tissue, that is true. It exists as budding yeast, and it forms the hyphae, which is the filamentous form, as it invades host tissues. Okay. Causes thrush, that is true. Impaired cell-mediated immunity is an important predisposing factor in formation of this disease. That is true, because people who have HIV are predisposed to this disease. And number 11, we have done this. A patient is invaded with invasive aspergillosis treated with voriconazole. What's the primary mechanism? Yes, any answer?
D.
B. Or what have you said?
D for dog.
D for dog, yes. Inhibition of lanosterol, D. 14-alpha demethylase. That is the azoles. Good. Inhibition of ergosterol synthesis by blocking squalene epoxidase drug. Chop, 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 chop.
Terbinafine.
Terbinafine. Good. Inhibition of fungal DNA and RNA synthesis.
Flucytosine.
Flucytosine. Good. Binding of ergosterol creating pores on the fungal membrane. Steve is quiet. Are you there?
Yes, I'm there.
What's the answer for choice C? I've explained up there. Answer, who knows?
Amphotericin B.
Amphotericin B, good. And nystatin. And then E, inhibition of 1,3 beta 1,3 glucan synthesis. What's the answer? What's the answer? echinocanins, okay? This is the cell wall. It's an enzyme used in formation of the cell wall, okay? Haya. A farmer in Africa presents with chronic warty cauliflower-like skin lesions on his legs. Histopathology shows brown pigmented fungi with thick-walled sclerotic bodies. So this is very specific. What did you find as the answer? The medulla bodies. Mm-hmm. What is the, first of all, what disease is this? Hello?
Chromoblastomycosis.
Chromoblastomycosis. Very good. Now that is the first step in knowing what it is. Now, what is the cause of chromoblastomycosis?
Cladosporium.
Trace? Which choice? Okay, let's eliminate. It's definitely not crypto and Candida. We have already gone through that. Sporothrix schenki. So so Sporothrix schenki causes something called known as sporotrichosis, yes. So how this thing presents is it presents with nodular lesions that follow a certain pattern. So it causes something called ascending lymphangitis. Okay. So what happens is when you are let's say you're a gardener, you get scratched by a plant that has this fungal, it is going to cause ascending lymphangitis, basically following the lymph node pattern on your skin. Okay, I want you guys to go check it. This Sporothrix schenki. Okay, even on spot, you're going to see, if you see someone, their hand and there is a certain pattern, it's going straight. Okay, that is Sporothrix schenki. Then this epidermophyton, that is tinea. Okay, that one causes tinea. We call them dermatophytes. So things like tinea pedis, which is the athlete's foot, tinea corporis, all those are epidermophytons, they're dermatophytes. So the answer remains Fonseca pedrosoi. Okay, it causes the chromoblastomycosis. Yeah. So you'd have used the elimination to try and get it, okay? Then number 13, a 50-year-old HIV positive man presents with pneumonia-like symptoms and meningitis. A latex agglutination test detects polysaccharide you already know the answer. What's the answer?
Cryptococcus.
Cryptococcus, yes. You see how it can get easy, especially if you know the keywords. Mycology, the trick about mycology is you have to know the keywords for these specific diseases. Not useful in the lab diagnosis of Candida albicans. But this is straight from your notes.
Birdseed agar.
Birdseed agar, it's used in?
Cryptococcus.
Cryptococcus neoformans, okay? Good. SDA is I get that pronunciation wrong. Sub what? Subrod, dextrose agar. Okay. Yeah, the rest are okay. Blood agar, cornmeal agar, and serum. And number 15. A 28-year-old woman is diagnosed with tinea pedis, which is the athlete's foot, and is prescribed an oral antifungal that inhibits squalene epoxidase. Which drug is that? What's the answer?
A.
Terbinafine, good. So can we take like a 3-minute break, then we come back? Then we come continue and finish up.
Yeah, that's okay.
Okay.